welcome to our podcast, Dr. Diaries Adventures to Ireland. I'm your host, Graham. The aim of this podcast is to showcase doctors' relocation journeys to Ireland. So whether you're a doctor interested in the move or just curious about life in Ireland, this is the podcast for you. Now, let's get into today's episode. Hello and welcome to this week's episode of Dr. Diaries, and today we have Genevieve joining us. Genevieve, thanks for joining us. Tell us a little bit about you.
Thanks for having me, Graham. I moved to Ireland almost 3 years ago. September will be 3 years, and you obviously assisted with that process. I kind of was a GP by background prior to moving, and I've really moved, I always had a kind of interest in women's health, and I really moved into a women's health space in Ireland, in that I'm working in a menopause clinic in Dublin, which I really enjoy.
Yeah, amazing. And what celebrations have you lined up for your 3-year anniversary in Ireland?
No celebrations yet. Actually, it kind of coincides with our wedding anniversary as well, so I'm sure there'll be something big happening.
So you remind me again, you got married just before you moved?
Just before the pandemic. So we got married in 2019, and then in the September, and then by the February, March, we were in a full-blown lockdown.
Yeah, that was again, quite a wild time to relocate.
Yes.
Relocating is never easy. Take us back to that time, and maybe even beforehand, and talk us through what you were doing in South Africa before you made the move, and then we can pick your brain on why Ireland was drawing you over to this part of the world.
So I studied and trained in South Africa, and after my training I worked in the emergency department for a few years, and then kind of felt that I was ready for a change, and so moved into the GP space, and I loved working as a GP. And when we got married in 2019, my husband, soon after our wedding, said, I think we should look at emigrating. And I was like, no ways, I don't want to move. We've just got married, we have our home, I've liked my job, I don't want to move. And then COVID happened and lockdown, and I think we just it was quite a good time to kind of pause and reflect on where we were in our lives and where we wanted to go. And I think we were both feeling, actually, it would be quite nice to experience living somewhere different. We just weren't sure where that was. So we kind of had an inkling that we wanted to move, but weren't really sure where and what that would look like. I found working as a GP during the pandemic extremely stressful, as I'm sure many people did. It was, a time of a lot of uncertainty. And
Absolutely.
so I think...
And you were at the very front of it as well, weren't you, within the primary care setting?
Yeah, exactly. So I think I was feeling a bit of kind of, I suppose, burnout from that, and feeling like maybe I'd like to move into something where I wasn't on the front line, I wasn't seeing patients who had COVID, and women's health had always been my interest. So these were just kind of thoughts in my head. And then my best friend... I'd spoken to my best friend who had spoken to you, and she was telling me that they were thinking of moving to Ireland, and that it would happen pretty quickly. And so I then had to think about, okay, well, Ireland, we'd at least know someone, because she was moving over. And,
Who was that again?
Katie.
Yes.
Yeah.
Okay,
so they moved to Ballinsloe in January 2021.
Katie and Tim, wasn't it?
Katie and Tim, exactly. Yeah. So she kind of got the ball rolling in that she had spoken to you, and then she put me in contact with you. And I think we had a chat, but then nothing really came of it. Again, we just weren't ready to commit to a move, I think. And then a few months later, I think you had sent an email that there was a women's health GP position available in Cork. And so that, I think we got back in contact then. And then that didn't really work out. But then you had said to me, well, would you consider the Menopause Hub as a place to work?
Yeah.
And then that's when it really all came together.
Yeah, and that's as you say, the rest is history. And talk us about the Menopause Hub. I know the team there are very visible in the public eye. I know you're the leader of the whole operation. Loretta is you're really doing a lot of work to get public visibility on what is quite an important service that the Menopause Hub is providing to menopausal women across the country.
Yeah, absolutely. I mean, when I was living in South Africa, although I was, I had an interest in women's health, menopause was not really something that we really spoke about. There wasn't a huge interest in it like there is here. It may have changed now, but I remember when the opportunity came to have the interview with Loretta, I thought, well, it's not an area that I know a huge amount. It'd be a good opportunity for me to kind of further my knowledge and skills in that area of women's health. Um, and I think just before I started working, there was that Joe Duffy week where they spoke about menopause every
Yes.
day that week. And that kind of really blew things up in Ireland. There was suddenly a huge amount of discussion about menopause and perimenopause and menopause in the workplace, and the need for kind of dedicated centres for women to feel seen and heard and to kind of get assistance on their menopause journey. And so when I joined in 2021, it was like a wild time. It was so busy. We were inundated with calls and emails. There was so much demand. And, to be honest, almost 3 years down the line, there's still a huge demand. The menopause, Loretta's amazing. She's really a pioneer in this field, and she has a marketing background. So she really knows how to communicate people and has made menopause very kind of accessible for people to understand. So we now have 3 clinics open, 2 in Dublin and 1 in Cork. And, since we've opened, a lot of other menopause clinics have opened. They're more kind of public menopause clinics as well. But we're still just as busy. There's still just as much of a demand, which is really interesting to me.
Yeah, amazing, and the amazing work you do. If you could, talk us through what a normal day would look like within a women's health clinic, just an overview to give people a bit of an insight into the type of work that you're doing.
So I think, one of the biggest things for me when I started was when I thought of menopause, I had a very specific idea in my head of who or what a menopausal woman looked like.
Yeah.
But actually, we see a very wide variety of patients, so probably from kind of 40 to 65, 70 is the range of patients that we'd see, obviously all women. Um, Going through either kind of starting their perimenopause journey, they're already in menopause, or they've had something happen to them that's kind of forced them into menopause, or they've had to stop their medication, if they've had a breast cancer diagnosis and had to stop their HRT. And so we really try and help women navigate all aspects of this journey. So the typical day for me would be a combination of initial consultations and review consultations. An initial consult is a 30-minute consult. So it's a good amount of time to connect with the patient. We go through their symptoms. There are over 40 symptoms of menopause. So we kind of flesh that all out,
Hey,
go through their
wow.
symptoms. Yeah. Yeah. Their medical history, their family history, their expectations of the consult and what they're hoping for. Some women come in hoping that they'll be able to go on HRT. Some women just want to have a chat about menopause and understand more about it. And I think, it just shows that it's an area of women's health which has been neglected for so long that, women don't even know how to start and how to understand this aspect of their kind of reproductive journey, the
Okay.
end of their
So
reproductive journey.
education piece is quite a large part of what you do.
Yeah, absolutely. And, because Loretta is so involved in the space, I've been really lucky to go on to, I've done quite a lot of webinars, educating people about menopause, doing menopause in the workplace webinars. I've had opportunity to write a lot of articles and things. There's so much demand for information about menopause.
Yeah. And bring you back to SA, could you have pictured yourself in such a job? Because you seem to really, really be enjoying the space that you're in right now.
I love it. I really love it. And I think it's a really rewarding space because you see women coming in feeling terrible or hopeless or not knowing what to do. And we can really guide them and support them. And they come back a few months later, feeling so much better. So it's really rewarding. But I think, you know, if I think of working in South Africa and as a GP, and I really enjoyed that work, but this is a whole different level. This is really focused. I really feel like I have a niche that I can excel in because it's a limited area. There's so much that you can learn about it and know about it. You can make a
Yeah.
big difference. So no, I mean it's not at all what I pictured for myself, but actually it seems like the perfect thing for me. I really love it.
Do you see yourself doing anything else in the future? Or this is your lane now?
Yeah, I feel like I'm really in this lane, and I've just completed like a menopause specialist accreditation through the British Menopause Society. So that's been
Yeah.
really good.
Well done.
Thank you. But I think, working alongside Loretta, there is more to this than just, the clinical practice. There's role to expand into menopause in the workplace and education, educating doctors, educating patients, educating employees. So it's a really big space, and I'd be very happy to stay in it long term.
Amazing. Yeah. What a think plenty of people, no doubt, either whether it's in SA or across Europe or in other parts of the world, might be thinking, I've got a family medicine background, I've got quite an interest in women's health. How could I possibly get into this space? So I think you're certainly sharing a bit of an insight in terms of what that actually looks like on a day-to-day basis. So thanks for sharing that. We might jump into a couple quick fire questions now to see what have you
Sure.
picked up in your close to 3 years here in Ireland. So tell us, aside from Dublin, where you're living right now, where's your favourite place in Ireland?
Um, I love Waterford. So Katie and Tim actually live in Waterford now, and so we've been to visit them a lot. And it's such a beautiful part of the country. And I mean, the coastline is amazing. We love to swim, so it's a great place to
Yeah.
swim and go for long walks.
You've
And
joined the brave or daft Irish in jumping into the Irish Sea.
yeah, and I can't believe it because the first Christmas we were here, we swam in the sea because that's what people do here is they swim in the sea on Christmas Day.
Yeah.
And at the time I was like, this is insane. Why would anyone want to do this? And then kind of around the summertime, we started swimming and we just got in the habit and swim quite consistently now. And it's amazing. I
Yeah.
do. I mean, my friends in South Africa will think I'm a bit crazy that we would get in the sea when it's so cold. But it's great. I love it.
Yeah, and I'm a big sea swim believer too, and it's great for the head, if anything
Yeah,
else. And it's a lovely community
exactly.
activity to do as well.
Yeah,
And just get yourself away from everything technology and life wise, and just jump
yeah,
into the cold Irish Sea.
exactly.
Great, Waterford. Yeah, Waterford. I'm a big fan of the sunny southeast too.
Yes.
Next one, favorite Irish celebrity.
So I probably share the world's obsession with Paul Mescal because how can you
Okay.
not like that man? But there are a lot of kind of Instagram influencers that I follow. There's Roz Purcell who does the Hike Life on Instagram, and she always
Yeah,
posts amazing places to see around Ireland and where to hike and where to eat and where to swim. So she's brilliant. And
yeah.
then there's a comedian called Kaylee Trapp. She's really good. She does lip syncing. So she'll take a
Okay.
clip from a podcast or something. So like from the Two Johnnies or from My Therapist Ghosted Me. So kind of really relevant Irish things. But then she'll
Yeah.
lip sync to the audio and she's brilliant. She's so funny. So I could spend hours
Amazing.
watching her reels.
You put proper thought into that, and yeah, you've got a whole spread of celebrities that you follow. So I'm guessing as soon as Gladiator 2 comes to cinemas, you'll be rushing down to get your ticket and
I
see
mean,
Paul
you can't
Mescal
miss
in
him in a
action.
skirt.
I don't think you'll be the only one
No.
with that, Genevieve. Next one for you. Favorite Irish phrase or slang that when you heard the first time, you thought, what the hell are they talking about there?
I mean, there were lots of those. It was really a baptism by fire. Initially, people would say things to me, and I must have had a blank expression half the time. I didn't know what they were talking about. And I
Yeah,
remember someone saying to me the first time something about your man. Your man had done this test for me. I was like, my man? What would my man be? Like, I don't understand. But for people in South Africa, it's you would refer to any kind of generic person. So it could be the plumber, it could be your consultant, it could be a neighbor. You recall your man. So
yeah,
that was interesting. But my best thing is the way that Irish people say goodbye on the phone because it's never
yeah.
just bye and put down the phone. It's bye bye, bye 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 bye, bye 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 bye. And then you put down the phone.
And have you found yourself falling into that trap when you're talking to friends and family back home?
Yes, occasionally I do.
I think maybe it's people are maybe they want to get the last word in, or they don't want to say goodbye just yet.
Yeah.
Want to keep that conversation going. Talking of home, I know you guys are very firmly here. This is your new base and your new home, but there's still those home comforts back in SA. What are those that mean so much to you that you say you'll either family bring it across next time you're over here, or please post it over to me? What is it that you call your home comfort?
So my mum would visit quite a lot. So we're lucky enough that we get to get our South African fix quite
Yeah.
frequently. Rusks always have to go in the bag because you just can't
Okay.
get anything like rusks here. And then marshmallow Easter eggs. So it would be like a marshmallow covered in chocolate, and they would sell them at Easter time. But my mum always
Okay.
stocks up and brings them when she comes over.
Wow. And how
Yeah.
big are we talking here?
So it would be, I suppose, like a palm size. So it's like a flat
Yeah.
marshmallow covered in chocolate.
Okay.
But then Woolies, I mean, you must have heard of Woolies because all South
I
Africans
have.
love Woolworths. They
Yeah.
made kind of giant. marshmallow Easter eggs this year, so it was like the size of your whole hand. So my mum had to bring
Okay.
some of those for us.
Yeah, oh God, we'll have to. There's so many Safas here now. Surely there's somewhere some specialist shop that's selling those marshmallow Easter eggs. You have me salivating here now.
I'll
So
have to
I
organize
can.
some for you.
Yeah, amazing. Great stuff. And I guess I wonder then, moving on, if you were to give anyone contemplating the move across, whether they're from SA or from other parts of the world, considering a move to Ireland, what big piece of advice would you give them?
I mean, I think my biggest advice would be to do it. I mean, we came here without having ever visited the country. We knew very little about it, but it has been such a good experience. Not just, you know, it's not just that we love living here and our life is really good here, but it's also the whole experience of moving, and you really learn a lot about yourself, and you see the world in a different way, and you learn about a new culture, and it's been such a wonderful experience that I would say to anyone who's contemplating it, if you're thinking about it, you should do it, because you'll get so much back from the experience.
Amazing. And in terms of career wise, would there be any bit of advice that you would give to anyone?
I think know what you want to do, but be open to trying something different.
Okay.
Because I probably would never have considered working in menopause when I was working in South Africa, but again, it's been a really great experience, and I've learned so much doing it. So, you know, obviously, if you have if you're really specialized in something, then you'd want to stick to what you've specialized in. But if you have the opportunity to move into something, in a different role, you could, there could be great benefits to trying something different.
Sure. Yeah, I love that, and thanks for sharing that. I think you're a perfect example of that. Is you're as a, dare I say, a generalist within family medicine. There's so many different areas that you could look into, or just stick being a generalist. But you have very much gone in one very clear direction, and that's I think something that it's a growing area, as you say, when it comes to public interest. It's also a growing area in terms of where GPs would like to specialize or further specialize in. And it's great to hear that there's further specialist accreditations across the water in the UK, and who knows, maybe sometime in the near future there might be something here in Ireland as that need from patients as well as physicians grows.
Exactly.
So yeah, watch this space, particularly when Loretta is behind and being
Yes.
the big mouthpiece of the space. A lot, I'm sure, is going to positive change is going to happen over the next while.
Yeah,
Final thing for
absolutely.
you, Genevieve, before we let you go today is, what is the best part of life now here in Ireland for you and your partner?
I think our quality of life is much better. We spend a lot of time outdoors. We have a dog. We walk a lot. We swim. We feel very safe. Um, yeah, it's just we have a very different life to what we had in South Africa, but a really good life, and I think a good balance between kind of work and leisure as well, which has been great.
Any regrets?
No, maybe
No.
not doing it sooner.
Yeah. Okay. Wow. Okay. Yeah. Left very, very simply. Yeah. And like I say, you're both of you are really taking this on, and I know your partner is in a different space to yourself too in terms of work, and he himself also, I guess, it was a bit of a challenge and struggle finding his niche too. But now
Mm.
he's fully settled into working life here in Ireland too, and I make a point of highlighting that because a lot of doctors do come across here with their traveling spouse who is non-medical, and that too sometimes is a challenge. But interesting to hear that he was more up for it than you were initially, and now look where we are.
Yeah,
Amazing.
exactly.
Thanks so much, Genevieve, for sharing your story. I know there's going to be quite a number of people out there who are going to take a lot from this. So thanks again for taking the time.
You're welcome. Thanks for having me.
And next time I see you, I'll be looking forward to those Easter egg marshmallows.
Yes.
Thanks, Genevieve. Talk
Thanks,
soon.
Graham. Bye.
Thanks for listening to this week's episode. If you like what you heard today, please follow wherever you get your podcasts. Want to kickstart your relocation journey? Reach out to the team on our socials at Matchmates.